So great. So before we get started, I'd like to recognize that this presentation is in collaboration with Pancreatic Cancer Canada, and it is in recognition of Pancreatic Cancer Awareness Month. Today's topic is exploring grief and moving forward after a pancreatic cancer diagnosis. And our presenter for it is Elizabeth Doherty. Elizabeth is a social worker and educator with extensive experience supporting children, youth, and adults facing serious illness, uncertainty, and grief. After specializing in palliative care at the largest cancer treatment center in Canada, she started a virtual private practice in 2015 for individuals and families of all ages, following diagnosis of a serious illness into remission, at end of life, and into bereavement. Elizabeth is a community partner with the Children and Youth Grief Network and an assistant clinical professor with the Department of Family Medicine, Division of Palliative Care at McMaster University. Thank you so much for your time, Elizabeth. I'll let you take it forward. Thank you.
Thank you for that warm introduction. Welcome, everyone. I know today is a short time together to talk about a tremendous topic. I think so much in this space, right? Following a diagnosis of pancreatic cancer, there's so much more to say than not enough time. So I simply mentioned today as we move forward together, I'm sharing information based on my work across settings and sectors with people of all ages facing grief and trauma. I will not speak for the experience of another. In fact, I am not an expert in grief and loss. I defer to those I serve as experts in their own lives. So I simply say that with the idea that I am a lifelong learner. And while working in the field for over 2 decades, I'm continually learning, unlearning, and relearning, and will often offer more questions than answers. So I simply ask that as we move forward together today, any of the information I share, I invite you to see what resonates for you, right? If you happen to be a care provider, whether that's healthcare or caregiving for someone you know, you love, see what resonates for you, right? For those you love and for those you serve. So as we move forward, I think the starting place always, especially working in tertiary care, right? Specialized cancer care, I think it's an important reminder, right? As I see in my own private practice and in the work I've done serving thousands of individuals and families over the last 2 decades, people turn to healthcare experts in the system for guidance, for navigation, for support, for answers. And I think it's an important reminder that there is no required training about loss and grief for any healthcare provider. There's also no required training for palliative and end-of-life care for any healthcare provider. Now, having said that, that's another presentation. And while today is not about palliative and end-of-life care, I simply say that because as we move forward, it's considering the intersections of all things. As we even arrive in the space together today for a brief while, thinking about how you show up in the space today, all that you're carrying with you, all that you have lived, all that you bring forward, but also for those we connect with, right? So from identities to losses, to traumatic experiences, to strengths, to needs, to interests, to personalities. There's so many intersections that happen as people move forward from time of diagnosis, following a pancreatic cancer diagnosis all the way through. So I simply ask you to think about the intersection of all things as we come together in this space, as you navigate the healthcare system or offer care for someone you love or someone you serve in the healthcare system, but also the intersection of grief and grieving and all that it intersects in the process. So as we move forward, I think a big part of my role has always been, cancer is one word that describes so many different types of diagnoses, treatments, outcomes. The word cancer or pancreatic cancer itself carries and holds so much stigma. What I know to be true in my work as well is the person diagnosed with pancreatic cancer or their loved ones, right? Side effects and prognosis. There's so much stigma and weight navigating those, and so often isolating in the process, right? That's so often, whether it's the word or the weight of the word, the weight of the meaning, often the person or their family themselves can feel like they're right there, yet nobody knows how to acknowledge or notice, the weight of everything. So I simply say there's so much stigma and misunderstanding. And in effect, isolation in the process. And having worked at the largest cancer center in the country, I saw this firsthand, right? There are brilliant medical interventions and treatments, and we know that acute care hospitals focus on short-term episodic care. These interventions and treatments are aimed at cure. What that does is, while brilliant, creates an environment while death is essentially seen as a failure. What I see so often is death as a result is often denied. So what does that mean for someone living with a diagnosis that is not necessarily curative, or in fact, at time of diagnosis is determined to be incurable? Well, there's a lot of grief with that. This is actually from an organization in the States called the Dougie Center. They serve grieving families. And so this is actually a booklet that can be downloaded for free called Becoming Grief Informed. Now, I see it as a call to action, and so do many of my colleagues in the field, right? That it's certainly drawing on this document. It's critical to recognize how mainstream society, by mainstream, we're talking about healthcare, right? But the greater, bigger society as well, friends, family, workplaces, communities. It's critical to recognize how mainstream society understands grief, has a direct impact on how we address grief in our policies and practices, and vice versa. So if grief is denied, what does that mean for folks who are grieving or feeling grief? So, creative outlets are really an essential part, and I believe processing grief and loss, navigating illness. The image I actually have on the slide is from a Canadian artist. His name was Robert Pope, and he used his art as a medium to process his living with cancer and inevitably dying from his cancer. And so this is an image that he captured titled A Friend's Story. So for those waiting in the hospital, navigating the illness experience for the person and the family, what does that look like? What we know to be true is there is so much uncertainty, right? The unpredictable nature of an incurable illness means reversible and irreversible events and declining health interwoven with periods of stability. Patients and families live with knowing that death will come, but not knowing where or when. So it's really incumbent on, I believe, the healthcare system. And that's not to say that the healthcare system wasn't depleted before COVID. So many people doing the best they can with the resources they have available. But having said that, it's really tantamount and incumbent upon us as healthcare providers to create space for this process, this uncertainty, and then moving forward between the reversible and irreversible events. But what do we know to be true? And what we know to be true is, while the person, and I don't use the term patient in my practice, I'm in private practice now. Actually, my practice covers the province of Ontario. The word patient itself is a loss of identity, right? There's grief there. So often, and understandably, the person or the patient is seen as the focus of care. But we know that family is immediately impacted when the word cancer is introduced and thrust into someone's life. What does that mean in terms of serving the family? And we know that there's certainly grief from time of diagnosis when someone hears the word cancer, right? In a multitude of ways. And I'll talk about different types of loss in a moment, but we know there's grief beyond the individual receiving treatment, right? And I think I often remind, whether it's parents or aunts or uncles or caregivers, grandparents, whoever it might be, when they're kids or teens or young adults, I gently remind them, kids are really brilliant, kids of all ages, by the way, really brilliant at reading verbal cues, right? Words they overhear, words they can look up on devices, but nonverbal cues, changes in routines. So while I know so many adults feel they're protecting kids, teens, young adults by not telling them about news of a diagnosis or news of a prognosis, or, the specter of treatment and all of the range of side effects, what I know to be true in my practice serving kids, teens, young adults, and adults of all ages is that cancer diagnosis impacts the family from time of diagnosis all the way through. So trying to create a space to name something so uncertain, and yes, can be heartbreaking indeed, but how do we support the individual and the family going forward? Because we know the impact is so real, when often the person or patient is the one receiving care and treatment, right? So how do we broaden that to serve individuals beyond the diagnosis and specific targeted treatments? What we know to be true is the way not only someone receives, whether it's chemotherapy or radiation or surgery, but the way of holding space for someone, of acknowledging what's there, right? So another example of creative expression from Picasso, but it's an important reminder how precious words are and how real speech is and its impact on the way people live, and die. So following a diagnosis of pancreatic cancer, what I know to be true and what I hear all the time from folks that I serve is people are told with the best of intentions, be brave and stay strong. And while well-intentioned, those platitudes actually can be incredibly isolating for the person, whether it's the patient or family. And again, I say patient, recognizing that's a loss of identity, right? But when someone is told to be brave and stay strong, the inference is, hey, if there's any emotional vulnerability there, what does that mean? Because certainly that is not weakness, that is human. And there's such a profound amount of sadness, uncertainty, anxiety, anger, frustration, that comes with this process, right, of navigating a diagnosis of pancreatic cancer and moving forward. And so many say stay strong. And often people think that means suppressing, emotional expression or suppressing tears or suppressing any of it. All that does is really leave someone isolated with their feelings, their thoughts, their experiences. And what that really tells people is, hey, whatever that is, if it's not positivity, if it's not tamped down, just tidy it up and don't share it with me. Even though that's often not said directly, that's the inference, right? So many folks who are grieving, right? The uncertainty of a diagnosis, the uncertainty of what lies ahead, and they're told to be brave and stay strong, it's really tantamount to toxic positivity, right? So it doesn't mean people are weak, doesn't mean that they're not brave. In fact, what it is a profound amount of bravery moving forward following a diagnosis and an extraordinary amount of strength. But what does that look like for people? Again, here's another image from Robert Pope, encapsulating what it looks like and feels like to be in the hospital for certain points in time. So when we talk about exploring metabolizing grief and grieving, social media can be a wonderful force for good still, right? And there are many accounts, many professionals. I use my social media account solely for sharing resources around complex illness and navigating the healthcare system and grief and grieving, the holidays. So as we go forward, this is actually from something called the Grief Project. And I share this simply because there's so much tied up in grief and grieving. And what does grief look like? Most people think it's only sadness. We know, yes, there are tears. There can also be denial or anger. There can be regret and confusion. There can be profound sadness, yes, but an incredible amount of anxiety, confusion, and yes, loneliness. And while in the midst of all of this, there can still indeed be moments of joy, which a lot of people feel guilty about. Having said that, what does it look like? It looks different for everyone. So let's talk about defining grief. Grief is a starting point, and then I share this in the words of Dr. Kenneth Doka. Grief is a reaction to loss. We often confuse it as a reaction to death, but it's really just a very natural reaction to loss when we lose any significant form of attachment. Any significant form of attachment. Grief is the process of adjusting. So I'm going to ask you through the chat, I'm going to ask you to type and think about different types of loss. So when we talk about a diagnosis of pancreatic cancer, I'm going to invite folks to type in different types of loss or different types of grief, because when we talk about any significant form of attachment, you'll see here I interspersed an image saying COVID-19. Even saying COVID-19, we're heading into 2024, and it's just so foreign to think how the globe, how the world has been upended by this virus, right? But what it did is it showed the world there are a multitude of losses that happen in the absence of dying and death. So I invite folks to share through the chat any examples that they can think of different types of loss that happen following a pancreatic cancer diagnosis. And you're welcome to just hold that and reflect on that as well as we move forward. So as I invite you to think about different types of loss, I'm going to share some examples. Thank you for sharing that. So loss of certainty, loss of confidence, absolutely. Loss of independence, indeed. Right. And the reason I'm asking, and thank you both for sharing those reflections, is for so many people, when I speak to them, I see a real weight. And the weight they're carrying is often, I feel like there's something wrong with me, or I feel like I'm broken, or I don't know what's wrong with me. And what it is they're grieving these fractures below the surface that others can't see, but are very life-changing and very impactful. Thank you to the others for sharing loss of future, loss of family leadership, loss of the one person I can always go to. So thank you all for sharing those reflections. So I'm going to ask you to hold those in your mind as we go forward. Okay, remember I talked about the intersection of all things? While we're talking about anticipatory grief, it is not just one type. It is not just, a binary approach. There's an intersection in all of these things as we move forward. Okay, so I'm giving this as a definition for grief in general. Okay, So thinking about that, and the reason I say this is it's something I see quite often, right? While having worked in the healthcare system for over 25 years, I often don't see grief acknowledged until someone is actually actively dying or has died, okay? And the reason I mention this is because what that means is so isolating for us, right? For those we serve, for those we love, when we see that there is so much grief and grieving that happens before someone dies, right? And even in the absence of dying or death, right? There are so many different types of loss. So I appreciate everybody who just shared all of those different types of loss. So holding those in mind, see how those intersect with these other types of grief as we move forward, okay? So sharing that, I'm coming to this is actually a phenomenal resource. If you haven't come across it as yet, it's called What's Your Grief? It's a free website. And it's written by clinicians in the States who, experiencing their own loss and grief personally, even though they were working in the field, they wanted to turn to a place to develop, evidence-informed, so evidence-based research and resources into these short, digestible articles about grief, right? Because again, as I mentioned, there's no standard and required training for healthcare providers about grief and loss. So if it doesn't happen there, it's really not happening anywhere else unless someone elects to have this training, right? This awareness or psychoeducation, as we call it. So I defer and turn to What's Your Grief as a highly valued free resource. They actually have a free newsletter you can sign up for, and they send out prompts different times of the year. We are heading into a season of grief bursts in December, right? There's so many different holidays that can be such a trigger for so many, right? So I simply say this as a starting point to give a definition of anticipatory grief, okay? So anticipatory grief occurs before the loss, okay? And you can see that I say before a loss because it doesn't even just mean death. It can be any loss that happens, right? Any circumstances that can lead a person to think a loss is a possibility, they are going to start grieving aspects of the loss. And this is very much determined by the connection, the attachment they have to that, right? That experience or that person. Now, it's important to note that anticipatory grief doesn't mean a person will grieve any less, and they may process elements of the loss over time, and it can bring up a lot of complicated experiences, but it doesn't mean when someone grieves in advance of the loss, that when the loss and the finality of that loss happens, that they're over it, that they're prepared for it, that grief is time limited and done. What it is, though, is the process of grieving in advance of that loss. Okay, so thinking about examples of anticipatory grief, thinking about the examples you just shared in the chat as well, holding that in mind, consider that as we go forward, because there is not just anticipatory grief. So there are non-death losses. We see this following a cancer diagnosis, right? A person can grieve anything significant to their physical, psychological, spiritual, and interpersonal being. So that is the person diagnosed with cancer, but it is also family members, right, who see and bear witness to those losses and how their lives are fractured as a result of a pancreatic cancer diagnosis. Those are non-death losses, right? And yes, throughout a person's life, and COVID showed us how many non-death losses happen, losses of community, ritual, routine, but certainly following a cancer diagnosis. And actually, in fact, when I was speaking to folks virtually, because my practice used to be community-based after I left the hospital. So I'd visit folks in their home. And then when COVID happened, while I always had a virtual practice, it gave a whole bunch of validity to being able to connect with people in their homes. They didn't have to travel, right? They couldn't travel. Having said that, so many folks, what I know to be true is when they are isolated at home because they're navigating chemo or, having just had surgery or going through radiation and recognizing they're immunocompromised. For so many that have had to be protected and isolated, so many of them, the folks that I spoke to when the world shut down, so many folks shared, well, at least now the rest of the world has a tiny idea of what it's like, following cancer treatment or during cancer treatment, to know just how isolating it is to be, cordoned away in your home, right? So I simply say this because there are so many non-death losses that come with a cancer diagnosis, right, that aren't recognized as such. And while, yes, healthcare teams are really brilliant with recognizing, nausea or, physical pain, constipation or diarrhea, what does it look like to make space for and acknowledge loss? And so there are so many non-death losses, right? What about appetite? The number of people I speak to, again, having just had, different holidays that are celebrated and more coming up, for so many people, just missing the opportunity to be able to eat foods that they love, or actually eat foods they love and not have them taste a way that is tainted by chemo, or just being able to metabolize food in a way that they couldn't before surgery, So I simply say this because there's a multitude of non-death losses. So I ask you to hold that in mind, right? What are some examples of non-death loss as you think about that? And secondary losses, after grieving a devastating loss, and yes, a diagnosis itself is a loss, right, of so many things. People are surprised to find there's a ripple effect of subsequent and secondary losses. So it's, certainly there's that primary loss that happens, but what it does is it causes shifts and fractures in the world as that person knew it, or, family. And I say family in terms of how the person identifies family. Sometimes it's family of origin, biological connections. Others, it's chosen family. Those are, by the way, are examples of secondary losses too, when people are no longer able to have access or support to chosen or to biological family connections for a number of reasons. Having said that, secondary losses, okay? And so these are things, those other fractures that outside of the grief and grieving that those people are feeling directly, most people don't appreciate what that's like, right? So I simply say that because one of the biggest losses, secondary losses I see and hear from folks all the time is friends, family, colleagues, right? So either people come forward with advice that they feel is essential for this person to hear, whether they need to meditate more or juice more or whatever more, right? Think more positively, they can get through this. Just need to keep giving that, best fight possible. While those well-intentioned offerings are well-intentioned offerings, what it does is it either creates isolation and dismisses the person and their experience, or people step back and step away because they don't know what to say or how to say it. So the most common secondary loss I see from diagnosis all the way through, even at end of life and into bereavement, is people stepping back and stepping away and not being supportive in a way that someone had hoped. And talking about, the changes that happen over time, there's something called ambiguous loss. So this is actually grieving someone who's still living, right? And it's different than the certainty and finality of grief when someone dies, right? It's tied to that event. Ambiguous loss is when someone or something profoundly changes or disappears over time. You think about the profound impact of a pancreatic cancer diagnosis, right? On someone's body and bodily autonomy and routines and rituals for them, right? But also for those they love. So there's that ambiguous loss of someone still being present, but so vastly different and changing. And so, yes, life as it was before feels like it's fading away. So ambiguous loss, thinking about some examples of ambiguous loss, is indeed impactful. And I think many people will say, and not understand outside of these experiences, well, your person's still here. What's so hard about that? Or what's so heartbreaking about that? And I think that's a privileged viewpoint for people who don't know what grief and grieving is like following a pancreatic cancer diagnosis. And while, yes, we're talking about anticipatory grief, it's also important to recognize there is cumulative loss, okay? So cumulative loss is really the experience of multiple losses happening, and that could be over time, that could be happening in quick succession. It's an important recognition to, acknowledge that we don't grieve something and get over it and that's it, right? Is that we continue to grieve, losses over time, right? As long as we have a connection to something or someone, we will continue to grieve it. So cumulative loss really speaks to the multiple losses that can happen, right? So thinking again, what are some examples of cumulative loss? Because what we know to be true, following a pancreatic cancer diagnosis, some amount of cumulative grief or loss is always a given, right? One thing after another. So I simply say this because when people I speak to in my practice will say, it just feels like so much. This speaks to cumulative loss, right? And this can happen, following a diagnosis. So that gentle reminder again, when many people think grief and grieving only happens when someone dies, it's all of these examples, right? As people go forward. There's also something called non-finite loss, right? So non-finite loss, again, at whatever point in your own personal experience, you think, okay, these are my hopes and my dreams, whatever those are, right? About how we hope our life will turn out. We know so many things are out of our control. And certainly a cancer diagnosis, people don't plan for, people don't dream about. It thrusts its way into someone's life, interrupting, one's life. And certainly talk about taking things, out of control, out of one's control, right? So non-finite grief is something that those hopes and dreams that we've carried, whatever they might be, and they are so uniquely personal, it's those non-finite losses that happen of, and it was mentioned in the chat, right? of roles, of identities, of hopes, of plans. So non-finite loss is those hopes and dreams that feel like they're just, continually finding that, life in a multitude of ways following a pancreatic cancer diagnosis can fall short of those dreams, those hopes, those expectations. And there's real impact with that. When we talk about disenfranchised loss, disenfranchised grief is something, and there's so many examples of this, but it's the grief that someone feels when they're denied the right to grieve. So, for some people, they might only need validation from within themselves internally, right? They might have their own processes, and while they might be or feel disenfranchised in their experience, it might be something they uniquely process on their own and find their way forward. But what we know as well is there are so many that by wider society, community, they're discounted or minimized or devalued or overlooked. So, whether that's family, friends, society as a whole. So the impact of disenfranchised grief can often leave the person not only incredibly isolated, but often alienated, invalidated, feeling ashamed, weak. So, what disenfranchised loss looks like is unique for each person, but there are so many folks that are inherently disenfranchised in their identities, their experiences, and in their loss and grief as well. And so coming back to this document I highlighted at the outset, Becoming Grief Informed, it's an important reminder that while many people think, especially in healthcare and medicine, there's a prescriptive approach to something should be done a certain way. It's an important reminder because each one of us is unique. Our lives, our lived experiences, our strengths, our interests, our communities, right? Because each person's experience of loss is unique, because each person has their own beliefs, assumptions, and experiences, it would be illogical and inherently contradictory to assume there are correct and incorrect ways to grieve. And I simply say this because, yes, well, as a social worker, serving and connecting with folks facing, complex diagnoses for over 2 decades, so often I meet with folks and they'll say, someone said I had to talk about my feelings. And I gently remind people that, yes, while that serves some, not everybody's a talker, right? And so processing the experience going forward, I'll come back to that. But I think for many, they're also given this expectation of you need to find closure, right? And so we don't slam a door closed on someone or something we love, walk away and never look back, never think about the experience or the person. Closure is a myth in grief and grieving, but it is an effort to tidy it up and move forward, right? Curing or fixing grief. There is no closure in grief, right? There might be some answers that might, be able to, be given, but certainly in terms of getting over grief, there is no getting over or fixing grief. There are no set timelines in grief either. There are no stages, and so it's an important reminder that we continue to grieve someone or something after that loss or losses, right? And it's never just one loss. So grieving the loss means learning to move forward, not on, right? Not getting over, but carrying the loss and honoring that connection in meaningful and supportive ways. And so, many will hear about the stages of grief. And while Elizabeth Kubler-Ross was actually researching people who were facing their own dying and death a number of decades ago, it's often been carried forward into bereavement, right? After someone dies. And bereavement, yes, is the grief that happens after someone dies. It's an important reminder that there are no stages. There is no neat and tidy checking a box and moving forward. That grief actually is an incredibly unpredictable, experience and series of experiences that impact our whole being as we move forward. Yet because there is no timeline for grief, so many, and I speak to people about this all the time. In fact, today I spoke to 2 people in my practice alone. We're talking about navigating the business of grieving, the sheer amount of paperwork that comes with whether it's taking a leave from work or applying for financial benefits, which, by the way, Money Matters program through Wellspring is a brilliant resource for those requiring support with that. But the business aspect of grieving, and yes, in bereavement, if anything, people might be given 1 to 3 days off, most often unpaid. So as you can see, we offer 3 days of bereavement leave. I take it will be plenty of time to resolve your grief. We know the grief that happens before and the grief that happens after, right, is certainly not only, ongoing, but so many expect it to be time limited and tidy. And the people I was speaking to today submitting their paperwork, they said they were greeted with a, well, thank you, have a great day, right? A real disconnect for the person and their experience. So again, not even tying grief to someone dying or having died, but all of the grief that happens following a pancreatic cancer diagnosis. So what grief and grieving looks like is so uniquely personal. And it's an important reminder, as I said, there is no closure, there is no time limit on grief. Grief lasts as long as love lasts. Yeah, thank you for sharing that. And so, I share this. This is actually from an author. And so she's a clinician who writes about her own grief. And her name's Megan Devine. So on social media, she's known as Refuge in Grief. So this map cartography of grief is really an example of that, right? And I think a big part of my role in my practice is always navigating the uncertainty following a diagnosis, right? There's so much advocacy at a time when someone is so understandably vulnerable, and there's so much uncertainty now to navigate, right? But with that, the grief and grieving as well. So navigating that, right, it can be incredibly anxiety provoking among other experiences. So grieving itself, navigating a diagnosis of pancreatic cancer, navigating grief, means uncertainty and oftentimes anxious experiences as well. So what that looks like for people. As we talk about metabolizing loss and grief, and I appreciate metabolizing anything is so different in the face of a pancreatic cancer diagnosis. And again, talking about secondary losses, the number of folks that I speak to, just their own, metabolizing food, right? How incredibly painful or disruptive or disheartening that is, following a diagnosis, whether that's through surgery or chemo. But as we talk about metabolizing loss and grief, it's really integrating loss and grief for each one of us, right? It's a reminder it's unique for each person. And it's influenced by so many factors, right? Risk factors and what we also call protective factors. And so what goes into that stage in the life cycle? And so I simply say this because I've worked with kids as young as 4 who are very intuitive and aware, and they will just very honestly and vulnerably and authentically share what they're noticing, right? They'll have great big questions, they'll have great big feelings, but they're authentic about it, right? And so I'm simply saying this because many folks will say kids or teens or young adults have no idea, or they want to protect them or isolate them or keep them aside. So it's not an indication that because someone is younger, that they are unprepared, unwilling, or incapable of being present, of acknowledging loss and grief and connection. It's also to say I've worked with folks in their 90s that, push against it about the injustice of life robbing them so soon of being able to live as they'd intended. So I simply say that these are all considerations, right? But it's unique for each person. So what does it mean for the person at the stage in their life cycle, as well as their exposure to an illness history? So whether that's their own, whether that's someone they love, whether that's a chronic illness, a recent diagnosis, or for many, and especially in the case of pancreatic cancer, recently advanced diagnosis, right? So something that is incurable. When we talk about loss history as well, as I've already mentioned, grief is certainly something that happens in the absence of dying and death. So what does loss history look like for each person, whether they've experienced, a death in the family or deaths before? Again, family is defined by the person. Certainly, as was already mentioned in the chat, and as we've highlighted, identity, we know following a cancer diagnosis, and again, so many people I speak to, I think for so many, they'll reflect on the fact that even getting out of bed in the morning is a privilege, right? Knowing that they can trust their feet, their footing, their energy. So mobility, right? And connection to others as well, by the way. Trauma history is another experience, and I'll speak briefly about trauma in a second, but certainly what that means. And that's not to say that if someone's got an exposure to trauma or trauma history, that means they cannot tolerate anymore. In fact, the opposite can be true. Because there is exposure to trauma and trauma history, they may be able to integrate and metabolize in a way that others in the absence of trauma or traumatic events have not. I also want to highlight as well, it's not our place to define trauma or traumatic events for others, but certainly what we know to be true is a diagnosis itself, navigating the healthcare system, accessing treatment, all of those can indeed be traumatic events for, individuals and families following a pancreatic cancer diagnosis. So just keeping that in mind, even with the best of intentions, right, for so many healthcare providers and institutions. But there can be real traumatic experiences at the hands of the healthcare system as people are moving through such challenging, life-changing experiences. It's also important to recognize that people process grief and loss, and that's integrated based on someone's coping and communication styles, right? Many are very avoidant or have maladaptive coping strategies. So that also influences how they're going to process grief and grieving. And it's also important to consider cultural and personal values, right? So people can turn to that as a source of comfort, or strength, or connection, while others will turn away. And that's also true of spirituality or religious affiliation. Some might find comfort in that, some might turn away from that. And what I also see to be true is within families, there can be conflict around, but we want to do this. And others within the family will say, but that no longer serves me anymore. It doesn't suit me right now. So there can often be conflict around expectations within families around what that should look like. And again, talking about connections, presence or absence of a support network and community. Now, I have absolutely walked into family meetings where there have been 14 people and they could not be more disconnected and conflicted. And I've also walked in and held space and family support with 2 people that could not be more connected and supportive. So it's not about volume of people, but about the quality of those connections and those intentions. And also important to recognize any additional stressors, whether that's caregiving or financial implications or isolation. As already mentioned, there's an isolation that happens already after a cancer diagnosis, right? I already mentioned trauma. And so for any that aren't familiar with Dr. Gabor Mate, his writing, his work, I simply wanted to highlight this, right? That, well, Dr. Gabor Mate talks about trauma is a Greek word for wound. Trauma is not what happens to you. Trauma is what happens inside you as a result of what happened. Trauma is not the event that inflicted the wound. Trauma is the wound that is sustained as a result. If trauma is what happened to you, guess what? It'll never unhappen. Every traumatic event is stressful, but not every stressful event is traumatic. But if the trauma wound happens inside you, the wound that you're carrying, that can heal at any time. I simply say that because, again, when we talk about the fractures that happen for folks, this is below the surface, right? Others can't see this. There is no MRI or CT that is going to indicate traumatic impact or traumatic influences or those wounds, right? So important to hold space as we move forward. And many know PTSD, right? Post-traumatic stress disorder. What we also know to be true is post-traumatic growth. Post-traumatic growth is not at all saying that traumatic events are viewed as desirable. In fact, that's not it at all. But when they happen or occur or reoccur, what we know to be true, remember that stay brave, stay strong. We know to be true is strength is often correlated almost paradoxically with an increased sense of being vulnerable. And what we also know to be true is because in these experiences, there can be so much isolation, it's the voices of others, right? Moving through trauma that is always important, building community and connections in post-traumatic growth. It reduces the isolation, it offers validation, right? It offers connection, it offers support. So yes, post-traumatic growth is indeed a powerful experience. And I also I alluded to this earlier about, you should really talk to someone about this. I simply say this coming back to what I highlighted earlier. I often refer to this as like being right-handed or left-handed, that presumably we don't judge people for being right-handed or left-handed. I would hope not, but people are often judged for not talking about their feelings or experiences. And I wanted to highlight this as kind of an educational or an awareness point that there's something called intuitive grieving and instrumental grieving, and then there's a blended approach. So intuitive grievers are someone who metabolizes their grief, their grieving, these life-changing experiences through being. So they'll lean into emotional or spiritual outlets. They'll want to talk about the emotional impact or the spiritual or meaning behind it for them, right? They prefer connecting with someone eye to eye or just really connecting with someone to talk about these experiences, right? And they integrate and process their grief and their grieving through doing just that, connecting with someone, talking about it, okay? Conversely, and like being left-handed, and there's no correlation between being left-handed and being an instrumental griever, by the way, there are others who metabolize through doing, right? So these are folks who will lean into mental tasks or physical tasks. These are people who do things, right? So these are folks that just want to know they're not alone. So being shoulder to shoulder with someone, by the way, in support groups, instrumental grievers might attend, but might not say a lot. But they have validation just by being there and hearing someone else talk about an experience and thinking, oh yeah, you get it, right? Connection with the voices of others. Shoulder to shoulder or back to back, knowing they're not alone, okay? So these will be folks when I often hear people say, I want to talk to my parent or my spouse or my sibling or my teenager, but they're going out for a run or they're going out and whatever, playing video games, doing something physical, right? They're not sitting and being and talking about their feelings. So I simply say this because for many who are instrumental grievers, they're going to go do something with their grief, where intuitive grievers will want to be and sit and talk. So this isn't dismissing, right, someone's ability to connect. What it is certainly acknowledging and honoring this. And that within this, there's a blended approach. So some people can do both, right? Either or, depending on their needs, their interests, their abilities. I simply say this because when someone says, why won't they sit and talk to me? again, the hope is if someone is left-handed, you're not going to force them to write with their right hand and say, you have to do this, right? It's what's wrong with you that you can't write with your right hand. Recognizing intuitive and instrumental grieving and the whole continuum in between. So because this is so unique in every family, within every family, there are going to be intuitive grievers and instrumental grievers and folks that can take a blended approach. So I think it's acknowledging and recognizing what each person is capable of doing and honoring that, right? And so this is kind of what a screenshot of it looks like, is that, it's a continuum, but within that, because grief, we know happens from time of diagnosis all the way through, looking at the impact. So mentally, right? And these are fractures below the surface people can't see, but it could be, someone ruminating or thinking about a specific experience, or there's real brain fog, either for the person living with cancer or their loved ones, trouble recall, trouble organizing. So we know there's a real mental impact that comes with grief and grieving, and that's so unique for each person, but people can't see it. We know the range of emotions. There's so much more than sadness, as I've already highlighted, right? And we know so the most common, yes, sadness, but anxiety, anger, frustration, to name just a few. And when joy still pops up, we know there's a lot of guilt that comes with that too. When we talk about spiritual, that can be spiritual, that can be religious, there can be an intersection between them, but how and where someone finds and makes meaning. And then the physical impact, right? So for many, they'll notice, again, it's one whole thing for the person going through treatment, contending with the side effects of treatment and moving forward, right? There are so many physical losses that happen, but we know the impact of grief itself has a real physical toll, right? From energy to appetite to sleep. So all that to say is that also, lends itself to the social impact, right? While people step back and step away, or when we feel like, hey, we don't want to tolerate any small talk. So our threshold for being around people and noise and small talk certainly lessens, right? And then the practical impact, actually getting out to be able to do things, certainly changes drastically too. So it's not that people are incapable. This is the impact of grief and grieving and what that looks like as people go forward. And so these researchers actually talked about what's called a dual process model. Okay, so think about, so it's referred to as oscillation. Think about an oscillating fan. It's processing loss and grief and moving forward. So in everyday life, right, it's this back and forth process of it's not a closure and moving on and shutting the door and getting over it, but this oscillation that happens from time of diagnosis throughout someone's experience, whether that is chronic, whether that is curative, or whether that is incurable, right? And then into bereavement. So I simply say this because grief and grieving is like an oscillation. You don't arrive, check a box, and that's done, and you don't revisit it. It's this back and forth. And yes, the individual within the family, whatever family looks like for that person. And it's an important reminder as well for kids and teens. We refer to it as puddle jumping. So they might be able to jump into an experience or thought or feeling and then just as quickly jump back out, right? They don't sit in these experiences as long as adults do. And that's not a bad thing. That's just the way that's, that oscillation is different for kids and teens. And I wanted to mention this as well, again, following diagnosis of pancreatic cancer, there are grief bursts that can happen, and these can happen in a multitude of ways. The researcher that identified this, it can be referred to as a sudden temporary upsurge, right? Grief burst, or subsequent after the initial loss. It's a common part of grieving. And I don't like the word normal because normal infers abnormal, right? As a contrast. So grief bursts are common in grieving. And so it's important to recognize there are different types of grief bursts that can occur. I say this simply because somebody will say, what's wrong with me? I was doing okay, and then suddenly I wasn't. I just ask you to consider grief bursts, right? So yes, they can be tied to special calendar events. There's a whole lot coming up in December for so many people with different celebrations and rituals. But they're also birthdays, anniversaries, right? So special calendar events can be a grief burst. After a diagnosis, right? The wondering of what that might look like going forward. And even after someone dies, right? So those special calendar events take on a different meaning after pancreatic cancer diagnosis. There are also linear events, milestones across a lifetime. Remember, we talked about non-finite grief, anticipatory grief, right? So that could be someone looking forward to a graduation or a wedding or childbirth, either their own or a grandchild, right? And even retirement. So many people I speak to say this is not what I planned, right? Stimulus cued are the ones that people don't see coming. That's hard to prepare for. I simply mention it because it's anything that's connected to our sight, sound, scent, taste, or touch. And I say this because, the number of people I speak to are out shopping. and see, something that reminds them of, whether it's the person who, is grocery shopping seems to be a big place, but now every mall is decorated for the holidays. There are so many grief bursts that are reminders, but so uniquely personal for each person. So whether you hear a song or see something, smell something, taste a favorite food, it's those sensory experiences that can bring grief right back. And with that, that visceral reminder of what is changing, and it might be forever changed, or it might be temporary. Having said that, those grief bursts are not only real, they are common and they are expected. So I simply say this because when they pop up, right, the point is not to dismiss them or minimize them. And I know many people are in a public space where they're trying to get out, where they can feel like they're in a safer space. So with that unexpected intensity that can come, how does one care for oneself as they go forward in a supportive way? And this is coming back to what's your grief. A model that I highlight a lot is, a lot of people think they have to get over grief, right? Like it's somehow, how do I fix this? How do I get through it as quickly as possible? It's not that connection, that attachment shrinks over time, but how do we continue to live and move forward and grow around grief and grieving? So there's a lot to be said. And I think for so many, someone I was speaking to this morning was saying, what's wrong with me that this feels so hard and so intense, and how do I fix it? So I think it's an important reminder that, while often not acknowledged until someone is dying or has died, that grief is not a disorder, a disease, or a sign of weakness. It is the emotional, physical, and spiritual necessity and the price we pay for love. And the only cure for grief is to grieve. So based on what I've shared so far, it's so important to care for ourselves as we go forward, as well as those we love. You can see, coming back to that creative expression from Robert Pope, I think a big part is acknowledging and coming back to the words of Megan Devine, acknowledging our own grief as worthy of respect helps us create a world where all loss is held as worthy. And for so many, they'll say, I'm fine. So as long as we just, dismiss or suppress our grief and grieving, doesn't create space to honor it, right? To hold space for it and to explore healing. So this is the words of Dr. Rita Sharon, founder of narrative medicine at Columbia University. I had the pleasure of meeting Rita. And so she talks about, for many people, they say, I want to know exactly what I should do or what it should look like. Rita, as a physician, talked about that, and healthcare even. A lot of people think it's very scientific and predictable and guaranteed outcomes, right? And Rita talks about the fact that creativity is not elective in healthcare. Creativity and doubt are at the core of our work in healthcare, right? Regardless of the treatment, the expected side effects, those outcomes, there is always an element of doubt, right? There is not certainty. And so with that, there's also, how do we take creative approaches, not only to offering care, delivering care, but also caring for ourselves. So in the face of that uncertainty, many people will say, well, how am I supposed to do this? Rita highlighted this quote that has always stuck with me. In the words of Vincent van Gogh, you can see another image there, right? I'm always doing what I cannot do yet in order to learn how to do it. For so many that have high standards and want to fix and prepare and plan and do things just perfect, I don't believe there's perfect, by the way. I believe we do the best we can, and that changes and shifts and evolves. We are always doing what we cannot do yet in order to learn how to do it. And so with that, I highlight the words from Pema Chodron in the process of healing. When things fall apart, things falling apart is a kind of testing and also a kind of healing. We think the point is to pass the test or to overcome the problem. The truth is, things don't really get solved. They come together and they fall apart again, then they come together again and fall apart again. It's just like that. The healing comes from letting there be room for all of this to happen. Room for grief, for relief, for misery, and for joy. So Nora McInerney is an amazing author, speaker, podcaster. If you don't know who she is, I highly encourage you to take a look at her TED Talk, talking about, moving forward in grief. She started a podcast called Terrible, Thanks for Asking, because she was so tired of saying fine, thanks for asking after her husband was diagnosed with cancer and her father. So Nora McInerney has a brilliant TED Talk, brilliant podcast, and she's a brilliant author, has a number of great books about processing grief and grieving. The reason I highlight this is I think one of the biggest sources of distress I see for folks is navigating their boundaries, right? And so when we talk about boundaries, sometimes, yes, it is about who we're trying to keep out. Establishing healthy boundaries with people, whether that's friends, family, colleagues, but it is also what we're trying to protect and grow on the inside of those boundaries, caring for ourselves as we go forward. This is a card I've actually held since my first internship back in 1993. And, while I mean with all due respect and great respect, whatever your higher power or center is, it's that important reminder to what can we control, right? And what do we make space for within that process? So exploring, and by the way, I'm not saying a pancreatic cancer diagnosis offers serenity in any way, but it is finding way forward, right? About the things that we cannot change, courage to change the things we can, how we respond within these experiences, and the wisdom to know the difference. And I know this is so uniquely personal for each person. And I think for so many, there's worry about the complexity of the feelings. And so this is from another great Instagram account, Bless the Messy. So this is certainly that important reminder to sit with feelings. Yes, they can be big and intense at times, but there will be an after. And, in terms of conversation prompts, either for checking in for yourself or with those you love or those you serve, I often talk about the 3 W's, right? So wonder. What are you wondering about right now? Some of those questions that we have following a pancreatic cancer diagnosis, we might be able to answer. We might be able to find an answer, connect with colleagues or healthcare providers who can give an answer or some direction. Some questions can't be answered. And that also just making space for that. And in doing so, making space for worry. We know fear is so real and often really not explored or acknowledged. So what fears are founded and completely understandable? What fears can we demystify and reassure around that we can provide support or address? And lastly, wish, exploring hope, what that means for each person. Exploring and making space for that is so essential. And I think the other part too, whether it's a conversation with someone we love or even just, holding space for our own thoughts, just making space for that quiet, that connection, and even listening to another, right? This quote has always resonated with me as well. I love listening. It's one of the only places where you can be still and moved at the same time. And I often remind, when I'm teaching, there's an acronym, especially in healthcare, when appointments can be so rushed and hurried. I often remind the acronym, WAIT. Why am I talking? So when we're having a conversation with someone else around these big life-changing experiences, holding spaces and wait, right? But lastly, the power of connection. Remember, I already mentioned post-traumatic growth. We already know, and we'll hear more about the connection of community within Wellspring and Pancreatic Cancer Canada. Community is, yes, people living in the same place, but it's also about that feeling of fellowship, of connection when we share, a particular characteristic or experience. Yes, pancreatic cancer diagnosis, living with a pancreatic cancer diagnosis, caring for someone, what that looks like. So it's an important reminder, rarely, if ever, are any of us healed in isolation. Healing is an act of communion. And when I talk about gratitude, it's not to dismiss the hard stuff or the big stuff, but to counterbalance what are we capable of or making space for in a given moment. Because yes, our breath in a given moment, movement in a given moment, what does quality of life look like? This is from Dr. B.J. Miller, palliative care physician. So often I see people asked about quality of life only at the end of life. What does that mean for each one of us here and now? And for me, it means seeing the extraordinary in the ordinary, right? When so much loss can happen following a pancreatic cancer diagnosis, whether that is movement, meals, connection, community, how do we bring it back to those small moments, which are anything but small? So in terms of places to find support, there are a couple different resources I wanted to share quickly, and we have a little bit of time for Q&A. There's something called Actively Moving Forward. So this is for grieving young adults at ages 18 to 30. This is a free app, free resources. This is an app called A Part of Me. So this is a video game where teens and young adults can actually navigate and play through a game that is built around providing grief support. A number of podcasts. And again, when we talk about a diagnosis, right, moving forward, connecting with the voices of others, listening to a podcast can be so connecting and validating and supportive. Recommended books, right? So again, when we can read about others' experiences, offering strategy, connection, community. And I wanted to share a number of resources quickly before we turn to Q&A. So for anyone who isn't familiar with Canadian Virtual Hospice, it is the largest online repository globally, and it happens to be Canadian, and all of the resources I'm going to share are available for free. So if you just search up Canadian Virtual Hospice, all of these are available from the landing page, mygrief.ca. So grieving for adults, Indigenous voices, living my culture, living out loud. So this is for young adults in particular. Two-Spirit and LGBTQ+, Caring Together Life. Now this is actually caring for those that are caring for kids. This in particular, kids grief, for so many, and I'm honored to have been part of the development committee for kids grief and youth grief. So this is for teens. So this is what do we say for grieving kids and teens. And lastly, I know that there are more questions than answers. So I just simply wanted to close on this. The most important questions don't seem to have ready answers, but the questions themselves have a healing power when they are shared. An answer is an invitation to stop thinking about something, to stop wondering. Life has no such stopping places. Life is a process whose every event is connected to the moment that just went by. An unanswered question is a fine traveling companion. It sharpens your eye for the road. So while, as mentioned, I use my social media to share resources around complex illness, grief, and grieving, I know that Wellspring and Pancreatic Cancer Canada are extraordinary communities that also provide support. So turning to this now.
Thank you, Elizabeth, for that wonderful presentation. That was incredibly insightful and reflective, and I'm sure our participants have questions that we'll get to in a minute. I just wanted to quickly thank Pancreatic Cancer Canada once again for our partnership that has made this webinar possible. Pancreatic Cancer Canada offers some programs, one of which is peer support in partnership with Wellspring. So if you go to the website Pancreatic Cancer Canada and you look for peer support, you will be linked to the Wellspring registration for one-on-one peer support with a peer support volunteer. There is also Ask an Expert, which provides access to medical experts to answer questions between doctor's appointments, and that provides suggestions to help patients, caregivers, and their family members to make informed decisions about care and treatment, and just to be able to go there prepared. And all these services are free and available across Canada. So please reach out to us. Thank you.